All right, and folks said they wanted me to start with head and neck, fascia, and lymph nodes. So we're gonna do this one first, and we're gonna do it for about 25 minutes. I'll even set a timer to make sure I go over, or don't go over. And then we'll use the rest of the time for the triangles of the neck. All right, so cervical fascia and lymphatics of the head and neck. So skip over this. Organization of the integument, which is just like organization of like the skin unit. So most superficially, you have the skin, which is made up of the epidermis and the dermis. Then you have below that, or excuse me, deep to that, you have the subcutaneous tissue. And then deep to the subcutaneous tissue, you have the deep fascia. And then within the fascia is where you're going to have like your muscles and your organs. So again, we can see in this picture, here is our epidermis, which is the most superficial.
We can't see your screen.
Oh, we can't? Okay.
Yeah.
Here, I will exit out and start over again. What about now?
Yes.
Okay, great. So let's start that over again. Okay, so organization of the integument. So when we're talking about like looking at a person, looking at their skin, most superficially, you're going to see the skin. On the outside, the most superficial is your epidermis, and then deep to your epidermis is your dermis. And then deep to the skin, you have the subcutaneous tissue. And then deep to the subcutaneous tissue, you have the deep fascia. And then the deep fascia is going to be surrounding your organs and your muscles. So you can see here in this picture, here is your epidermis. So that's your most superficial. And then there's multiple layers within here. And then here's your dermis. And then here's your subcutaneous tissue. Here's your deep fascia. And then here's your skeletal muscle, just to show you superficial to deep, the structures that are involved. So your lines of longer, or your tension or cleavage lines, are how the tension is in your skin, like running across your skin. These are the lines that we use when we're making incisions, so that when we go to close our incisions, we're trying to have the tension be parallel to our incision line, so that those incisions are less likely to come apart, as opposed to perpendicular. Like if you made an incision perpendicular to the lines of longer, that means you're going to put the most possible tension on that incision, and is way more likely to open up, like cause a hernia, especially in like the abdominal area. So we don't do that. We go along the tension lines. And this is not important enough. Okay, so your platysma. Your platysma is a muscle of facial expression. You can see here how this person is tensing their neck. Well, that is the action of your platysma. It tenses or relaxes your neck in order to help you emote your emotions through your facial expression. We mentioned how the platysma is a muscle of facial expression because there's a whole group of muscles of facial expression that are all innervated by facial nerve, which is cranial nerve 7. And you can see here in this image how here again is our skin made up of our epidermis and our dermis. Here's the subcutaneous tissue. And then you can see how your platysma, it's considered like it's underneath the subcutaneous tissue. So it's not surrounded by that deep cervical fascia that we're going to be talking about. It's superficial. Okay. When it comes to the bony and cartilaginous skeleton of the neck, you can see here your 7 cervical vertebrae of your spine. You can see your hyoid bone, as well as your thyroid cartilage, your cricoid cartilage, and then the beginning of your tracheal rings. Remember that your tracheal rings are not complete circles, they're C's. And then on the back of that C here is the trachealis muscle, because posterior to your trachea is your esophagus. So as food is coming down that esophagus, that bolus of food is going to bulge into the trachealis muscle, so bulging into the trachea, but then pass by. So when it comes to your deep cervical fascia, some of the important points about it: it forms compartments and cleavage planes. It limits the spread of infection and cancer. It is there to support structures and allow for gliding of structures across one another. Looking here, they've color coded it in this picture for you. So you can see how in green, the most superficial of the fascia layers is your investing fascia. In blue here is your prevertebral fascia. And then in purple here is your pretracheal fascia. In red here is your carotid sheath, and your carotid sheath is made up of contributions from all three layers. So from your investing layer, your prevertebral layer, and your pretracheal layer. This area back here is the danger space, where you can have spread of infection from the throat down to the mediastinum. This fascia layer that's running from carotid sheath to carotid sheath, and that's your alar fascia. And then, yeah, so this is the, well, hold on, let me show you it in a picture. There we go. So there's your alar fascia, and all of this area, the danger space, is called the retropharyngeal space. So this other piece of fascia that's connecting pretracheal to pretracheal and is posterior to your esophagus, this is your buccopharyngeal fascia. So in order from anterior to posterior, you can see how the green is your buccopharyngeal. This little pale orange fascia here is your alar fascia, and this actual orange fascia here is your prevertebral. So when studying these layers, be able to identify them on a picture like this, because that's how it'll show up on your test, is that they'll be labeled with arrows, and they'll ask you, like, you'll just have to be able to identify like which is which. Other important thing in this picture is your carotid sheath. Know what's inside of your carotid sheath. So it's your common carotid artery, your internal carotid artery, your IJV, your internal jugular vein, and your vagus nerve here. And there are also lymph nodes, but I don't know if those are like as stressed, but they are there. So again, looking at our fascial layers that are posterior to our esophagus, you can see here. So, well, actually we haven't hit our esophagus yet. The esophagus comes further down. So up here, it's in the posterior portion of your pharynx. So here's your pharynx. So pharynx, pharynx. And then here's your pharyngeal constrictor muscle. Posterior to that is your buccopharyngeal fascia. And then your alar fascia. And then your prevertebral fascia. So between your buccopharyngeal fascia and your alar fascia is that retropharyngeal space, that danger space, where you can have spread of infection from the throat all the way down into your mediastinum. And they make the point here that your buccopharyngeal fascia is a component of the pretracheal layer, which makes sense because it's posterior to it. Okay, so sensory nerves of the neck, you can see quite a few of them here. So note how you can see your transverse cervical nerve here coming across the neck, your supraclavicular nerve here coming down towards the clavicle, and then I believe this is your greater auricular nerve going up towards the ear. So in this particular picture, they're showing you the different layers of fascia and how here's your investing layer of fascia. Remember, that's the outermost, like the most superficial layer of fascia. And then here's your pretracheal layer of fascia that's deep to it. They're also showing you your carotid sheath here with some of its contents. And to see this, they've cut away the sternocleidomastoid muscle. So just remembering to access your carotid sheath, you have to cut away the sternocleidomastoid muscle. So your sternocleidomastoid muscle along with your trapezius muscle are both innervated by cranial nerve 11, which is spinal accessory nerve. They're considered, well, excuse me, their muscles enclosed by the investing layer of the deep cervical fascia. So they're both enclosed by that most superficial fascial layer. Okay. So when you remove that investing fascia, now we see a lot of the muscles in the neck. And we tend to group these muscles according to where they are in relation to your hyoid bone. So you have your suprahyoid muscles and your infrahyoid muscles. Your suprahyoid muscles include your digastric muscle, which forms this V here. It has an anterior belly and a posterior belly. Your stylohyoid muscle, which has attachment to the styloid process, which is further posterior in the hyoid bone. Your mylohyoid muscle, which is this fan-shaped muscle, and the two muscles meet at this median raphe here, and they're attached to your mandible here, as well as your hyoid bone here. And then deep to this set of muscles, you have your geniohyoid muscle, but it's not shown in this picture. Inferior to the hyoid bone, you can see here your sternohyoid muscle, so attachment to the hyoid bone, attachment to the sternum. You can see another, this one is a wider V-shaped muscle, but your omohyoid muscle. So this one has a superior muscle belly and an inferior muscle belly. And you can see also your, well, it's not labeled, oh yeah, it is labeled here, your sternothyroid muscle attached to your sternum and attached to your thyroid cartilage. And then cutting some of those muscles away, you can also see your thyrohyoid muscle, so attached to the hyoid bone and the thyroid cartilage. And then again, here's your carotid sheath. We've cut away the sternocleidomastoid muscle. You can see here your ansa cervicalis, which takes nerve fibers from C1, C2, and C3. C1 provides the superior root fibers. C2 and C3 provides the inferior root fibers. You can see the different branches going to innervate the muscles. Okay, so when it comes to borders, you're going to need to know the borders of the anterior and posterior triangles. So I'm just going to go ahead and click through the animations. So here's your anterior triangle, here's your posterior triangle. And you can see how your anterior triangle is bordered by the anterior border of your sternocleidomastoid, the inferior border of your mandible, and then this imaginary midline of the neck, which we draw from the apex of the chin all the way down to the jugular notch. So this apex of the chin is called the mental symphysis. Your posterior triangle, its borders are the posterior border of your sternocleidomastoid, the middle third of the clavicle, and then the anterior border of your trapezius muscle. And then within each of these larger triangles, there are smaller triangles. For the floor and the roof of the posterior triangle, you can see here, the roof is the investing layer of deep cervical fascia, and the floor is the prevertebral fascia. So roof, investing layer, floor, prevertebral layer. For anterior triangle, again, the roof is the investing layer of the deep cervical fascia, but the floor this time is your pretracheal fascia. And then again, here's your carotid sheath with your IJV, your common carotid artery, and your vagus nerve. And this is just pointing it out again on a different picture. Okay, so again, talking about the cutaneous nerves of the lateral neck, this is a better picture to see those nerves. So you can see your supraclavicular nerves going down towards your clavicle, your transverse cervical nerve coming across your neck, your greater auricular nerve coming up towards the ear, and then the lesser occipital nerve coming up to that occipital area of the skull. And this is all for sensory innervation of the anterior and lateral neck. Okay, so cranial nerve 11 spinal accessory. I already mentioned how it innervates your sternocleidomastoid muscle as well as your trapezius muscle. Well, shown here in this picture, you can see how the nerve travels within the investing fascia as it's crossing to the posterior triangle to innervate trapezius. So it's actually sandwiched in between two layers of investing fascia as it's traveling. And again, this is showing that danger space, that retropharyngeal space we were talking about before, but in a better picture to show you how the infection would travel down and then get into your mediastinum where your heart sits. And then you can also see like there's a pretracheal space as well where infection can pass on the anterior portion of the neck. So this plate is from Netter, and again, it's just showing you the same fascia, but just in a different picture. So you can see again, our bucopharyngeal fascia in green, our alar fascia in pink, and our prevertebral fascia in orange. And then remember that retropharyngeal space, that danger area, is posterior to the bucopharyngeal fascia, but anterior to the prevertebral fascia. Okay. And now on the posterior aspect of our patients, so looking from the back, this is the Pharyngo basilar fascia. So this X here is marking where that fascia is attached on the underside of the skull. You can see it's just like it's on the posterior aspect of the throat. These three muscles here, these are your constrictor muscles that actually comprise your throat, like they make your throat. So you have a superior, a middle, and an inferior constrictor muscle, and they all meet on this median raphe here. And so this is the muscles that are making up your pharynx, and then your pharynx is going to transition to your esophagus here. And then this is the backside of your thyroid gland. Okay, so we can see in this picture here, here's your buccinator muscle. It's another muscle of facial expression. Piercing through the buccinator muscle is the Perotic Duct. So the Perotic Duct is how saliva that's created in the parotid gland gets from the gland into the mouth. So it's via this duct, which I believe opens at the second maxillary molar. I believe that's where it opens, but please double check me on that, because that's a fact that Dr. Austin likes to quiz people on. Okay, so lymphatic drainage of the head and neck. You can see there are multiple different lymph nodes and groups of lymph nodes here. So first off, these are considered the pericervical collar of lymph nodes. So you have the occipital nodes, again, over in this area of the skull, which is like the occipital bone. You have the retroauricular nodes. So retroauricular translates to behind the ear. So retroauricular, also known as the mastoid nodes because the mastoid process is a part of the bone that's back here too. You have the parotid nodes because those are the glands that are right on top of the parotid gland. You have the submandibular nodes because these are the lymph nodes that are below the mandible. You have the submental nodes because these are the lymph nodes that are just below the mental part of the mandible. So that the tip of your chin is like the mental part of the mandible. So when you say submental, think below the chin. For your deep cervical nodes, you see you have an upper set as well as a lower set here. And then showing you the superficial cervical nodes as well. And then here you can see all of this lymph fluid. It drains through the nodes and then eventually it's going to drain back into the venous system. So this is your right lymphatic duct. And again, these are your lymph nodes just shown in a different picture. But again, you can see your occipital nodes, your retroauricular, superficial parotid, your submandibular, your submental. Included in this is now your buccal nodes, which you can see on the side of your cheek. And then your deep cervical nodes, you can see how you have your jugulo-digastric node, your accessory nodes, your infrahyoid nodes, your jugulo-omohyoid node, and your suprascapular nodes. A lot of these, like where they are is going to tell you, their name is going to tell you where they are. So when thinking about these lymph nodes, you have to think about what are they draining? What area of the head or neck are they draining? So your occipital lymph nodes are going to be draining this posterior portion of your scalp. Your retroauricular nodes are going to be draining this middle portion. Then your parotid nodes will be draining all of this area here from like the front of your skull as well as your eye. And then, so some of these lymph nodes, you'll notice a lot of the pathways will converge there. Jugulo-omohyoid is an example of that, how you have a lot of different like pathways that are going to end up draining into jugulo-omohyoid, which will then drain more directly into the venous system. And so important thing to note is how lymph fluid is draining from the body. So you'll notice how they have it highlighted here. Lymph drainage is different right side versus left side. So 25%, roughly a quarter of your body, its lymph fluid drains into the right lymphatic duct. So the right side of your head, the right side of your neck, the right side of your chest, and your right upper limb all drain into this right lymphatic duct, which you can see better here. Versus 75% of your body. So both of your lower limbs, your left upper limb and your left chest and the left side of your head and neck, that's draining into the thoracic duct here. So 75% versus 25%, you have to know that distinction because it's a very easy thing for them to test you on. But both of them, like both of these ducts, when they drain the lymph fluid back into the venous blood system, at each instance, it's where your internal jugular vein and your subclavian vein meet. So at that apex where they meet and then turn into your brachiocephalic veins. So right subclavian, left IJV, right IJV, right subclavian, creating your right brachiocephalic vein. And at that junction is your right lymphatic duct draining, left IJV, left subclavian, creating the left brachiocephalic. And at that junction is where the thoracic duct drains into. So this is a really good picture between this one and this one about the drainage of lymph fluid in your body. What was important about this? Lymph nodes and the deep cervical fascia. This is just kind of showing, this is just really showing the lymph nodes again, but in a different picture. And maybe just pointing out that you have like anterior and lateral superficial cervical lymph nodes. So just knowing where they are and knowing that these are the more like superficial lymph nodes as opposed to the deeper lymph nodes. Okay. And again, this is just another picture showing us those lymph nodes and the different patterns that they have. So jugulo-omohyoid, I mentioned as one of the lymph nodes that's going to drain. It's going to be close to like the end point of drainage. Another good one to know is your jugulo-digastric node, because you can see how there's many different pathways that can lead to this rather large lymph node. And then highlighted on this picture, so I'll mention them, how you have the anterior superficial cervical or anterior jugular nodes versus the posterior lateral superficial cervical, also known as your spinal accessory lymph nodes. And then these are lymph nodes that are present on the posterior aspect. So you can see how you can see jugulo-digastric, as well as jugulo-omohyoid, because they're on the side of the neck. You can see them anteriorly and posteriorly. But you also have retropharyngeal nodes here too. So a big thing is knowing what drains what from what area. So this picture is good because it's showing you how the tip of the tongue is going to drain into the submental nodes versus the posterior aspect of the tongue can drain into the jugular digastric versus the middle portion on the sides can drain into the submandibular nodes versus like the central portions can drain back as well. And I think there's color-coded pictures that help you more with this. Where is it? So this one's very good for showing you the different areas of the tongue and what lymph nodes they drain to. So you're definitely going to want to know this one. And then being able to identify like the different areas of lymph nodes off of these pictures in case they throw that on the test. So just knowing submental versus submandibular versus buccal versus parotid versus retroauricular versus occipital, and then showing how the arrows are draining each so you know that pathway of drainage. Okay. So that was the half that we were spend on this PowerPoint. And now I'm going to switch to a different PowerPoint. So give me just 1 second. Okay, can you see me sharing the triangles of the neck PowerPoint?
Yes.
Okay, great, awesome. All right, so we'll spend the rest of our time on this particular PowerPoint. So we already talked about this, but we're going to talk about it more. So you can see our anterior triangle versus our posterior, and in between them being the sternocleidomastoid muscle. So the sternocleidomastoid muscle is important when you're moving the neck. So moving it left or right, bending it back, lots of support. It's a very powerful and prominent muscle, especially when you actually like move your neck. You can feel it on the sides of your neck, and you can see it in other people. If they're like in really good shape, it'll bulge on the sides of their neck. So one clinical correlation when it comes to your sternocleidomastoid muscle is this condition called torticollis. So when you have this muscle paralyzed or injured, and then when it heals back, it can be fibrosed or shortened, you'll have it so that your patient, their head is stuck at a tilt. And the way you can tell which muscle is injured is that the chin is going to point away from the muscle that's injured. So in this patient, you can see how they've highlighted that this sternocleidomuscle, SCM. This SCM is the one that's injured, and the chin is pointing away from it. So that's how you know that it's this one that's injured. You can see how for this patient, their eyes aren't parallel, instead it's at a tilt. The lines of their lips are at a tilt, so their head is like at this tilt because of their injured muscle. For this child, this is like an extreme one where you can see how the eyes are not parallel, the line of the lips is not parallel, and the chin is pointing away from the injured muscle over here. So this is torticollis. Okay. So getting back to our triangles in the neck, you can see here in blue, this is our posterior triangle. And then these four smaller triangles are the subdivisions of your anterior triangle. Okay. When looking at the posterior triangles on the neck, it's important to know about the superficial nerves for sensory sensation on the neck. So again, here's our supraclavicular nerve. Here's our transverse cervical nerve. Here's our greater auricular nerve. And then here's our lesser occipital nerve. And then this is like, this picture up here is better if you just want to visualize the nerves themselves and not the muscles and blood vessels that are around them. This picture is great for you understanding what is the area that the individual nerves innervate. So you can see how on the lower portion of the ear, that's going to be greater auricular. However, behind the ear is going to be lesser occipital, and then transverse cervical across the neck, supraclavicular above the clavicle. But then on the posterior aspect of the skull, you have greater occipital and third occipital. So you actually have 3 different nerves with occipital in the name, having to do with innervation on the back of the head. Be careful, because she can, like in your test, they can actually ask you about nerve roots. So knowing that third occipital is from C3 will help you, because greater and lesser occipital are both from C2 nerve fibers. So just be careful there. Okay, and then superficial nerves of the neck, branches of your cervical plexus. Yeah, again, this is just showing those nerves, but they're not labeled. Let me guess. Yep. So this is a good way for you to quiz yourself. It's just looking at this without the animation and being like, okay, can I identify transverse cervical? Can I identify supraclavicular? Can I identify greater auricular or lesser occipital? Because that's how it will be on the test, is you just looking at the blank photos. We already talked about this. Okay, so your cervical plexus. So your cervical plexus is taking fibers from C1 to C5. And this is color coded. This is out of Moore, I believe. So this is color coded into different areas, what each nerves are doing. So the orange nerves are cranial nerves. So here is cranial nerve 11, spinal accessory, coming down to innervate your trapezius. Here is cranial nerve 12, hypoglossal nerve, going to innervate muscles like hypoglossal, meaning literally under the tongue. So muscles in that area. You can see how these green branches are all sensory branches that we've already talked about. So here's your supraclavicular nerves coming down. Here's your transverse cervical coming across the neck. And then here's your greater auricular and your lesser occipital nerves. You can see here the yellow loops are the loops in between each of the rami that are just connecting those fibers together. So that leaves just our motor branches, and specifically for our motor branches, for our motor branches, we have our ansa cervicalis here. So your ansa cervicalis is getting fibers from C1, C2, and C3. For C1, those fibers are going towards the superior part of your ansa cervicalis, versus C2 and C3 is for the inferior part. And we'll see more pictures of this coming. Another important nerve that you can see here is your phrenic nerve. So your phrenic nerve is going to go down and innervate your diaphragm. And it takes its fibers from C3, C4, and C5. So the mnemonic that we learned when trying to memorize that the phrenic nerve innervates the diaphragm is C3, C4, C5 keeps the diaphragm alive. So if you have injury to the phrenic nerve, you're going to have difficulty breathing. So, you know, kind of important. So again, here's our cervical plexus. And you can see how, where it is in relation to our carotid sheath and structures that are within the carotid sheath. So again, here's your common carotid artery, here's your IJV, and then we can see our ansa cervicalis here, taking fibers from C1, C2, and C3 to make big loop of nerves. And again, you can see here's your hypoglossal nerve. And then here is your spinal accessory nerve. Here is your greater auricular nerve, your lesser occipital nerve, all of these in this picture. Okay. So, talking about the triangles, we're going to start with our subclavian triangle. So for each of these, you're going to want to know borders, and if there's any contents, you're going to want to know the contents of the triangles. So your subclavian is literally here by your clavicle. The borders of your subclavian triangle include the inferior belly of omohyoid, the middle third of the clavicle, and the posterior border of your sternocleidomastoid muscle. Excuse me. Within your subclavian triangle, you have your subclavian artery, your subclavian vein, and the trunks of the brachial plexus all passing through. So here's your subclavian vein and your subclavian artery. Here's your first rib and your clavicle. So this is where the clavicle articulates with the manubrium of the sternum, and then it comes over. And we actually use our clavicle as, when we're trying to palpate for the ribs, you actually can't palpate the first rib because it's deep to the clavicle. So you use the clavicle as like your marker for where the first rib is. Okay, so your subclavian artery, like your axillary artery, has 3 parts, and you're going to want to learn the branches of your subclavian artery. So the mnemonic that we used when we were memorizing these was vitamin C and D. So vitamin stood for vertebral artery, internal thoracic artery, and thyrocervical trunk. C and D stood for costocervical trunk and dorsal scapular artery. Let's see, structures that cross in the floor of the posterior triangle. Oh, okay. So, important structure that you can see here, your phrenic nerve, your transverse cervical artery, as well as your suprascapular artery, which are both branches off of that thyrocervical trunk. So your subclavian artery, subclavian triangle, also known as your omohyoid triangle because of that omohyoid inferior belly creating that border for the triangle. So you can see how for this picture they've cut away the clavicle. So you can see all of the structures that are within here. Here's that brachial plexus coming through. You can see your subclavian artery, your subclavian vein, and then the actual subclavius muscle here. So that muscle underneath the clavicle, your subclavius muscle, is for cushioning and protection of the vessels beneath and the structures beneath. I'm trying to think if there's anything else important here. Maybe just that, okay, so here's your phrenic nerve that's passing through, and then here's your anterior scalene. So you can see how the phrenic nerve is running along your anterior scalene muscle. So sometimes they will ask you, or they will want you to know that the phrenic nerve is running on top of the, or is running superficial to the anterior scalene muscle, because you do have a middle scalene and then posterior. Okay. Subclavian vein puncture, this is the clinical correlation in this area. So knowing that this is a way for you to get venous access by using the landmark structures in the body, including the jugular notch, the sternocleidomastoid muscle, and the lateral side or the lateral end of the clavicle. And because we know our anatomy and we know the structures here, we know that that subclavian vein is going to come from that middle third of the clavicle. So just being able to like use anatomy to get venous access for, say, putting in drugs that you need to like go directly into the blood supply of your patient. Okay. So now we're talking about anterior triangle. And we've already talked about these borders. Okay. Subdivision of the anterior cervical region into 4 smaller triangles. Okay. So the 4 smaller triangles of your anterior neck triangle include your submental, your submandibular, your carotid, and your muscular. Now, if we're looking at it, okay, anterior region, triangle neck, superficial structures. So looking just superficially in this area, again, you can like point out these triangles, like, so you can see here's your submental, here's your submandibular, here's your carotid, and then here's your muscular. The muscular is called the muscular because your strap muscles are there. Your carotid is called your carotid because your common carotid artery is there. And then submental and submandibular are all because they're named after where they are in relation to the mandible. Okay. Structure superficial to the anterior triangles. So, of course, your skin would be superficial to all of these. Then the investing fascia roofs over the submental and muscular triangles. And then the anterior jugular veins and sometimes a jugular venous arch are located in the muscular triangle. So your muscular triangle is right here. And then this is your submental. Okay, so your muscular triangle has muscles, your strap muscles. So knowing your superior belly of omohyoid is here, your sternohyoid muscle is here. Your sternothyroid muscle should also be here, but deep. You just can't see it in this picture. What else will be important here? I think those are like the biggest things. Oh, hold on. There's going to be an animation. Nope, there's not an animation. Normally she would list like all the contents that she would want you to know in this particular triangle. I'm kind of surprised she didn't. Okay. Well, again, your suprahyoid muscles, which you can see pretty well in this picture. This piece of bone right here is your styloid process, hence how your stylohyoid muscle got its name, with attachment to the hyoid bone and the styloid process. Here's your mylohyoid. Here is your digastric, both anterior and posterior bellies. And then here's your hypoglossal muscle. Okay, I'm gonna go with her name because she's the one that's gonna test you. So your hypoglossal muscle. And then again, here's your median raphe of the mylohyoid that connects the two fan-shaped muscles together. And this is just the same muscles at a different angle. So the thing that she calls hypoglossal muscle, I learned is geniohyoid. Go with her name because she's the person that tests you. Okay, so we've already talked about our suprahyoid muscles. Let's talk about our infrahyoid muscles one more time because this is a good picture for them. So here's omohyoid, superior and inferior bellies. Here's sternohyoid, connecting the hyoid bone to the sternum. Here is thyrohyoid, connected to the thyroid cartilage and the hyoid bone, and sternothyroid, connected to the thyroid cartilage and the sternum. A lot of these, the name is telling you the information that you need. Okay, so innervation of our infrahyoid muscles. So again, here's our ansa cervicalis with fibers from C1, C2, and C3. C1 giving you the superior part of the loop, C2 and C3 giving you the inferior part of the loop. And then you can see how there's different nerves coming off of the loop that are going to those muscles. So C1 fibers, they're going to contribute to the ansa cervicalis, but then they're also going to branch off and give you nerve going to thyrohyoid and then nerve to geniohyoid. Coming down on that superior loop, you have the nerve to omohyoid muscle, the superior belly. So remembering the superior loop gives you the nerve to the superior belly of omohyoid. Then you have sternothyroid, sternohyoid, and then the inferior loop of the ansa cervicalis, giving you the nerve to the inferior belly of the omohyoid muscle. And then again here, C3, C4, C5, this is your phrenic nerve. Oh, and before I move on, again, here's your hypoglossal nerve, cranial nerve 12. And this is just another picture of your ansa cervicalis. So seeing in relation how you have C1 and C2 and C3 to make the loop, but you also have cranial nerve 12, hypoglossal nerve traveling alongside of C1 before it goes on its own pathway to innervate these muscles on the underside of the tongue. Can you find the ansa cervicalis in this drawing? Okay, so when in doubt, look for the loop. And also just remembering that it's going to rest on top of your IJV and your common carotid artery. So you can see how we have a loop here. So this is C2, this is C3, and then C1. Here's our loop that is over the IJV and the common carotid, along with the internal carotid here. This is your external carotid. And boom, there's our loop. Oh, yeah, sure. Go ahead.
Are they sensation nerves?
I'm sorry, your voice is really low. Can you speak a little louder, please?
Oh, okay. I said, are those sensation nerves, like the nerves in the loop?
No, ansa cervicalis is for motor innervation. So the ansa cervicalis is for innervation of muscles.
Okay. Thank you.
No problem. And in fact, if you go to here, let me go back to show you. Yeah, all these are muscles. So the ansa cervicalis is for innervation of muscles in the neck. So your geniohyoid, your thyrohyoid, your omohyoid, all those coming off of like these nerve fibers here. Okay, anatomy of the emergency airway. Okay, cricothyrotomy. So we've mentioned the thyroid cartilage and the cricoid cartilage. I can speak today. Earlier, when it comes to an emergency airway, it's called a cricothyrotomy. So the idea is that you're going to make a hole in this membrane that's in between the thyroid cartilage and the cricoid cartilage, and this is only for an emergency airway. In this particular patient, because it's a male, their thyroid cartilage is more prominent, so you can see like the Adam's apple. So you'd be able to feel it more easily. And other folks, it's a little bit harder to feel. But the best way to do it is to try and get somebody to swallow. And when they swallow, their thyroid cartilage actually moves. So obviously, if it's an emergency situation, it's not going to be an easy thing to get somebody to swallow. But yeah, you're supposed to feel for the thyroid cartilage, feel for the cricoid cartilage, and then in between them is going to be this membrane that you can pierce to make an emergency airway. Know about this more for the information and don't actually do it in real life unless you're like, in an ER. Okay. Submandibular triangle, again, name for its location, it's underneath the mandible. You can see how your submandibular gland is here. So there's 3 major glands for creation of saliva. You have your parotid gland, which is the biggest one, which is like this big, your submandibular gland, and then you have your sublingual gland, which is below the tongue, so it's more over here. It's deep over here. But you can see how in this triangle, you have both the submandibular gland as well as the submandibular lymph nodes. Okay. And then also important thing to note is that you can see facial artery and vein passing through this triangle as well. Oh, and then this is a better picture showing your sublingual gland, your submandibular gland, and your parotid gland. Parotid is huge. So knowing your submandibular triangle has the submandibular gland, facial artery and nerve, and your submandibular lymph nodes there. Okay. So for your carotid triangle, knowing the borders are the anterior border of your sternocleidomastoid, the superior belly of omohyoid, and then the posterior belly of digastric. And you can see how the hyoid bone is kind of sticking into the triangle. So the most important thing to know about your carotid triangle is your carotid sheath. You got to know the stuff that's in your carotid sheath. So that's your common carotid artery, your internal jugular vein, vagus nerve, specifically a posterior branch, as well as the ansa cervicalis and the deep cervical lymph nodes. They show the lymph nodes here. And we've seen that ansa cervicalis sitting on top of the common carotid and the IJV previously in this slide deck. Okay, so your carotid sinus and body, and I think I'm going to end on this. So your carotid sinus and body are two areas of receptors that you have that help with the regulation of your heart rate. And these are all part of the autonomic nervous system. So the carotid body is like this group of nerves here, and they're chemoreceptors. So specifically, they're going to respond to changes in CO2 or O2 in your blood. And depending on the levels of those, it's going to stimulate rate and depth. So stimulate changes to the rate and depth of your respiration, i.e. it could possibly make you hyperventilate. If you have too much CO2, you end up hyperventilating because that's a way for you to breathe off the CO2. It can change your blood pressure and it can change your cardiac rate. So that's the carotid body. Versus the carotid sinus is this bulging out of the internal carotid artery. And this bulging out is where you have baroreceptors or pressure receptors. So they're responding to the actual pressure of your blood. So when you have an increase in blood pressure, the reflexive response is for you to decrease your heart rate because it's like your body's trying to keep you in balance. So another important point about the carotid sinus is that you can actually massage it. And if you do that, it makes the body believe that the pressure is too high. So if the pressure is too high, it will then drop your heart rate and it can lead to fainting. And this is all like reflexes. So this is like you manipulating your body because you know that these reflexes exist. Usually a carotid massage happens in the hospital for people who have like a weird EKG, like I think it's VTAC. I can't remember off the top of my head, and you'll learn more about this when you get deeper into your studies when you're learning about cardio. But a carotid massage is an actual procedure that can be done in the ED due to an abnormal heart rhythm. Okay, and with that, I'm actually going to stop because we're coming to the end of the hour. What didn't we get to? Carotid arteries within the vicinity of the carotid triangle. Oh yeah, the branches of your external carotid artery. Yeah, it's a bunch. The contents of your carotid triangle, venous drainage, cervical portion of sympathetic trunk, and the submental triangle. Okay, I think you guys are gonna be okay to review these on your own. This is a really good picture from a previous student. But yeah, so for now, I'm going to stop sharing and stop recording.